Well, good afternoon, everyone, and welcome to today's webinar, sponsored and presented by Caravis, entitled Healthcare Options for NWFA Members. My name is Sharon Schaller, the Member Engagement Manager at NWFA, and I will serve as your moderator for today's webinar. And now I would like to introduce our presenters for today's webinar. Alyssa Scheinbein is a strategic advisor at Caravis. She has worked with Caravis for 4 years in a variety of different roles, which has helped her gain valuable experience with the nuances of health insurance. In her free time, Alyssa is learning to speak Portuguese and enjoys traveling. Chelsea Young is a strategic advisor at Caravis. She has worked with Caravis for 5 years in many different roles, including eligibility and as a client advocate for individual, senior, and group benefits. In her free time, Chelsea enjoys traveling and listening to music. Tanya Glynn is a team leader at Caravis. She has worked with Caravis for 8 years, developing a diverse client base, and in her free time, Tanya enjoys traveling and playing sports.
Thank you, Sharon, and thank you, everyone, for being with us today. We are just going to take you through a brief presentation of Caravis and then what we can offer to you as National Wood Floor Association members. So again, if you have any questions, feel free to type them in the chat box, or our contact information will be at the end, and feel free to call or email with any questions as well. So I will get started. We will just go through a little bit about Caravis. So Caravis has been around since 1978, and we have always had a singular focus on health coverage. This has allowed us to offer great service and become experts in what we do. We don't try to do it all. So we've always had a very fresh perspective on health insurance and finding new ways to offer our clients the best plans, the best rates, and just make sure they're offering the best benefits package that they can. We have dedicated teams that you will be working with. We have people dedicated to service and billing and eligibility, and then you'll have one of us as your team contact to work with you as well. So we at Caravis are one of the largest privately owned benefits firm in the region. We are located in St. Louis, Missouri. We have a 98% annual client retention rate. So we definitely provide great service to our clients, and they see the value in working with us. We have preferred agency status with all major insurance companies, which means that we have dedicated representatives and work very closely with all the insurance companies. And all of our lead advisors have an average of 21 years of experience working in health insurance. So you know that working with us, you will get a huge breadth of knowledge in the health insurance world. So we can offer, or we do offer, a lot of different ways that we help our clients. So we help with planning and implementation of any new benefits, health insurance, or anything ancillary such as dental, vision, life insurance, or disability. We help you work on cost containment strategies. So what is the best way to offer the best plans to your employees, but also keep costs low and manageable? We'll find the right mix of benefits for you, so tailoring everything to what your employees need. We do offer an online human resources and benefits administration tool called Caravis Connect. This is especially beneficial for groups with more employees, bigger groups of employees. That help. It's an online enrollment tool and helps you manage all of your benefits as well. And then for all of our clients, we work on benefit communication and education for your employees. So we are happy to do employee meetings, most likely over a webinar or a conference call. And then we will always prepare benefit booklet materials for your employees that will explain their benefits and how to best use their plans. So now we'll go into talking about some of the plan details, what we can offer to National Wood Flooring Association members. So our main plan design or plan type that we will be taking a look at is called a level funded plan. This is a different style of plan that takes the group's health and plan utilization into account. This is medically underwritten, which means that your rates are determined by the health of your group, of your employees. And with this type of plan, there is a potential for a surplus at the end of the plan year if your plan usage is lower than what is expected when we are underwritten. So this would be a return of some of the premium dollars that you pay in throughout the year. If they are not used to pay claims that come in, then you are potentially able to get a refund at the end of the year. We can look at several different types or styles of plan designs. So we can look at a traditional copay plan. So a lot of people are used to going to their doctor's office and paying their set copay, picking up their prescription, paying a set copay. We can look at those types of plans. We can look at plans that have copay visit frequency limits. So what this would do would help offset costs and help lower costs for you. We can look at high deductible health plans, which is another term for a health savings account compatible plan. And we can also look at health reimbursement arrangement plans. So this is when the employer reimburses employees for parts of their deductible to help employees offset those costs for medical expenses. And then we do have the option to offer multiple plan designs depending on the size of your group and how many employees you have. So this is a good way to strategize and a way to offer employees different options so they can pick one that best suits their needs. There are a lot of benefits of looking at these level-funded types of plans. A major benefit is claims transparency. So with these plans, you will receive a claims report each month that will provide information on plan utilization, claims taking place, and which type of services the claims money is going to. So it's very interesting to see. You get a very kind of behind-the-scenes look at how the plan is working. And many plans available today, you are not able to see this. Another benefit is a potential cost savings based on the group's health history. This would be from your current rate. So if you have a current plan in place, there is a potential for savings if you have a healthy group. So this would be a big benefit of looking at these plans as well. If you don't have anything in place, that's okay. It can still offer great rates because we'll take a look at the health of your group. Again, another benefit is the potential for the surplus at the end of the plan year if the plan runs better than expected. You have composite rates. So this is just 4 set rates depending on who is covered, whether it's employee only, an employee spouse, an employee plus a child, or a whole family. And this really helps with its ease of administration of your plan for payroll and other purposes. And then we are also able to customize your plan design. So there are many plan designs to choose from. And like I mentioned, this will allow you to pick benefits that best suit your employees and their needs. There are a few plan coverage qualifications. So we do need a minimum of 2 enrolled employees to write a plan. And at least one of those employees must be a standard W-2 employee and not an owner or a spouse. So we can write it with an owner and one W-2 employee, but we could not write with just 2 owners, for example. There is a participation requirement that at least 50% of all full-time employees must enroll in order to write the plan. So another thing we wanted to point out was about provider networks. So we work with a huge variety of provider network options, and we will help you pick the network that best suits the geographic location of your company and which will make the most sense so that employees have access to the largest variety of doctors, hospitals, and facilities. So just some things about finding the right plan for your specific group. So you might be asking, why would you participate? This is another solution to compare against your current plan. This would help you to make sure that you have the best plan and pricing available, and make sure you're doing the right thing for your employees. It also gives you the ability to enhance employee benefit packages by offering additional benefits. So this could be dental, vision, life insurance, long-term disability, or short-term disability. We can help you evaluate all of these plans in addition to the medical. If you have them in place today, we can help you make sure you're doing the best possible. And if not, we can help you get them into place as well. And then you will, along with these new plans and working with us, you will also receive all of our services that Caravis offers. So everything I went through at the beginning, working with us, you have access to us any time of the year. It doesn't matter if it's open enrollment or 6 months later. We are always here to help you and advocate on your behalf, and we are always here to provide our services throughout the entire year. So we can always be in communication throughout the year in regards to your insurance plans. Quoting is no charge, and you will not be locked in. So if you have something in place today and you're curious, but you like what you have, we can still take a look and evaluate and make sure you're doing the best thing possible. If you do not have anything in place today, but again, you're curious but can't commit at this moment and just want to see what's out there, quoting with us will not lock you in, and it will not cost you anything. It's just an opportunity to see what else is out there, make sure you're doing the best that you can. If we do an evaluation and quoting for you, and we find that your current offering is the best place that you can be, you do still have the option of partnering with us at Caravis and receiving our services and value adds that we offer. So there is a bit of information that we would need from you in order to get the quoting process started. We have a whole packet that is put together that we would send you through email, and it will give you a checklist of everything that we would need from you in order to quote. So we would need some basic employer information. We would need your current or renewal rates if you do have something in place today. We would need your most recent bill from your insurance company if you have something in place. We would need a wage and tax report, your most recently filed wage and tax report. And then we would need employee applications or enrollment forms. We would need this from all full-time eligible employees, whether they want the coverage and are going to enroll, or they're going to waive because they do not want the coverage. We can do this on paper applications, or we can also do it through an online tool called FormFire. So each employee would need to go in and fill out their application online. We would get this all set up for you and send you a link that employees can follow in order to fill out their application. I'm sure a lot of people are curious about how much time this will take. So the bulk of the time will be up front when we send that submission packet or quoting packet. We would just need to be sure to get all of that information back from you in order to take a quote, or to obtain a quote, I'm sorry. And the time requirement will really vary depending on how many employees you have and how difficult it might be to gather their enrollment forms from them. Then once we receive all your documentation, we will begin our process immediately. And depending on the time of the year, some times of the year are higher volume and busier for insurance carriers, so it could take about 1 to 4 weeks to receive quotes back. We also have a specific email address that you'll see on the screen for National Wood Flooring Association members. So all of those emails will go directly to us, and it's nwfa@caravis.com. If you would like to call, my direct phone number is 314-259-5003, and we can help with any questions you might have over the phone as well. So just wanted to thank everybody for your time, and hope that you learned a little bit and that we sparked your interest a little bit. Please feel free to reach out. We can send you our quoting packet, or we can just send you some additional information on Caravis and the partnership between us and National Wood Flooring Associations. Thank you so much, everybody, for your time today.
Tim asks, once a decision is made following the quote, is there a fee for partnering with Caravis?
There is not. So all of the insurance companies build administration fees into their rates. They are always there no matter what, no matter who you go through, and that is how we receive payment, and is directly through the insurance company.
So thank you, Alyssa. Thank you also for Chelsea and Tanya for being here. Thank you, everyone, for attending today's webinar sponsored by Caravis. And if you have any further questions, like Alyssa said, just email them at that nwfa@caravis.com.